We are focusing in this kind of atypical presentation of Alzheimer's disease and frontotemporal dementia that we know that have been also recently classified with the international criteria being published in 2011, so they are relatively recent criteria, and this is also understandable that the application of these criteria at the moment lead to a proportion of patients that are not able to be classified as one of the canonical or prototypical PPA that are logopenic, nonfluent, and semantic PPA variant. So our main focus was on mixed primary progressive aphasia, that are all these patients that have mixed criteria shared between logopenic or nonfluent, or logopenic and semantic, or nonfluent and semantic. And we are trying to understand if inside this group of mixed PPA there is a possibility to identify different clusters of patients, and also to correlate with this cluster and these findings to the pathological and functional data using both Alzheimer's disease biomarkers, both FDG-PET, to understand if the mixed linguistic alteration is linked to a mixed pathology, or to a mixed functional, to a mixed hypometabolic patterns consistent with different PPA variants. And at the moment, what we have found is that in the mixed PPA group, we can identify a cluster of patients with features shared between logopenic and nonfluent PPA that we define as logopenic nonfluent, and another group that shows shared features between logopenic and semantic PPA. And the interesting point at the moment, our main hypothesis that in these two groups there are patients with Alzheimer's disease that are not classifiable as logopenic, but still have like a continuum from the classical logopenic variant to semantic variant and to nonfluent variant. And we think that these patients can be considered in the more huge classification group of the Alzheimer's disease related PPA. And this is important also. The application for clinic is that, of course, we know that at the moment it's difficult to if we usually we are used to consider patients with this mixed presentation, or patients with nonfluent with some nonfluent feature as a non-Alzheimer disease, patients without Alzheimer's disease. But if this our results will be confirmed from future studies, this will lead to neurologists to consider also these patients for studies for Alzheimer's disease drugs, or for Alzheimer's disease for disease-modifying therapies. So not to exclude these patients, also because as the research goes on, the proportion of patients with mixed presentation tends to increase. So there are in our cohort we have about 40% of mixed PPA, and this is consistent also with the other reports. So this is a great amount of patients that used not to be considered in research for PPA and for Alzheimer's disease.